So if you've been swimming around the pool of lower back pain, you definitely would have heard the term classification before.
Why do we have to classify?
Well, just like other regions in the body, identifying specific structures can help us treat the condition more specifically. However, this has been quite lackluster when it comes to the lower back, unfortunately, due to the sheer complexity of the region, with many physios slapping a non-specific lower back pain on every patient they see. Whereas recent review by Mark Hancock in 2023 has shown pathoanatomical diagnosis of lower back pain to be effective.
Come on, show us a skibidi classification.
Let's call it individual physiotherapy, but before we get into the good stuff, let's get some other classifications out of the way first.
Starting off, we have the start back approach, which risk stratifies patients into 3 different groups. We have low risk. All they need is a little bit of reassurance plus advice. For example, your back pain is not that serious. It will start getting better soon. With these appropriate exercises and management strategies, you'll be okay. Then we have moderate risk. So with these patients, they're managed with manual therapy, exercise, as well as more education and advice. For example, so what we have going on is like moderate back pain. What we will do is we will do exercises and then we will do some physio techniques to help alleviate some of your pain. But you'll be okay. Then we have high risk. So how we treat them is we use cognitive functional therapy. For example,
I'm in a lot of pain and it stops me from doing things.
so what's happening is your pain is stopping you from doing what you love. But we want to get you back to doing what you love, and that's the most important part of managing this pain that you have. The start back approach has been found to be both reliable and valid and more effective than non-stratified approaches, according to Hill et al. In 2011.
Wow, that's awesome.
Next, we have the movement symptom impairment model, which suggests in order for your body to produce a movement, both the musculoskeletal system and the neurological system are involved. Hence why movements will always occur with the path of least resistance.
Cool, what's next?
Finally, we have the Mackenzie's classification, which classifies clients into postural, dysfunction, derangement, with postural being tissue stress without damage, dysfunction being adaptive shortening of structures, and derangement being anatomical displacement of structures, so your nucleus pulposus.
Makes sense. It's all starting to come together now.
Do not over-rely on these though. In a systematic review by Steins et al. 2016, they found that not one system is the best.
They found 22 systems.
Combining everything to make a more holistic judgment, these are just a rough guide.